will be able to provide you with some exciting updates about the plan. So Tina, go ahead.
Hi, thanks, Megan, and hello to everyone. Happy to have you all here today and to share a little bit about what we're doing and what we're working on for the future. So I've been working with the steering committee since the beginning, honestly, and then stepped into the role as the interim director here in September. Some of the initial focus for this particular work was branding and communications, and we've seen a lot of uptick now in participation in our social media campaigns, obviously our newsletters, and certainly that shows here today with the representation for those who are participating. So thank you for that. A couple of other spaces that we've been working on are some working groups that really were implemented initially by the NDPA this past summer. And we've been able to take on some of that work as it relates to the national implications that were found during the development of the plan. So those specific working groups really are working on some very strategic areas that will help kind of guide us moving forward. One of those working groups is specific to water competency and the layers of protection based on age. The second is a life jackets working group, which is really looking at how do we provide some consistent messaging and some educational guidance for families and for users on when and where life jackets can and should be used and the appropriate use of them as well. A third area is, and I know this is an area of conversation that we've talked about in the field for a long time, is research. And some of this certainly came out of the gaps analysis that we did in the working groups that developed the recommendations for the plan. And so part of the work currently going on is to create a research agenda that we can push out to hopefully see some participation across the US in identifying the needed areas and the information that's needed to help fill some of those gaps for us. And then the fourth area that we're focusing on is legislation, particularly in the form of model legislation and helping to create more or less of a template or a gold standard in some specific areas so that states and communities across the country have a piece of work that they can lean to provide them some guidance on perhaps what that gold standard could look like in their own community or in their own state, but that can also be modified to meet the needs of their specific area of the country. So those are some really key areas that we've been focusing on and have some great input from the working group members in those spaces. Some of the work has a timeline on the short term. The research agenda we're hoping to have available in early summer. And then some of the working groups certainly will take a little bit more time to get their work completed and to provide some initial documentation and reference points for folks. And then thirdly, the biggest thing that we've recently launched is the new website. And so I'm going to share my screen really quickly and kind of walk you through the new website for those of you who haven't had a chance potentially to take a look at it so far. Megan, can you give me a head nod if you can see okay, great. So there's the new website, watersafetyplan.us. If you go to the old website on Water Safety USA, it will redirect you so you won't get lost. This is the landing page for the initial, for the first page of the website, certainly our homepage, and really, really proud of the branding and the coloring and everything else that has gone along with getting the information condensed into a format that we can utilize. It's a very simple layout for folks. You won't get lost, and certainly things circle around between the different pages as well. At the bottom of the homepage, which is where many of you maybe found the information on the webinar today, is where you'll find information on upcoming office hours, any additional webinars or engagement opportunities. This is where we're currently going to host them. As we expand the website over the next year or perhaps longer than that, we'll find additional locations to post this out. But for now, in the interim, it'll be posted at the bottom of the homepage to make it easily accessible for everyone. At the top navigation across the website, you'll see initially the tools for action, which is where a lot of folks are really spending their time, right? We've spent some time developing specific documents for you all to be able to utilize in implementing strategies in your own communities. And so wanted to make these easily accessible for you. So if you clicked on tools for action, it'll bring you to the guidance documents, the key areas of action, the recommendations database itself. And then as we continue to build out the website, additional resources will be available as well. So this first click button, if you will, the guidance documents, the specific documents, the PDFs that you've been used to seeing and downloading, they're all available here still. I've broken up the page into 2 sections here, but in the middle of that particular page is where you'll be able to download the documents in hard copy form. But everything else has been spelled out here so that it provides at least an overview of the information that you're looking for as far as trajectory and next steps and things along those lines. Key areas of action have been broken down into cards here so that if you were to click on, let's say, barriers, entrapment, and electrical safety, it will take you specifically to that working group's information, talk about what the working group itself was, and provide you with a list of all of the recommendations under that specific key area of focus. And then at the very top of the homepage or any page that you're on, you'll see the action recommendations button. So without having to go anywhere else, you can access the entire database with all of the action recommendations. Within that listing section as well, you'll see about where I've highlighted key areas of action. That's another sublink that will take you back to the previous page with the cards. And then the spectrum of prevention is also laid out in more detail within the website. And so those links are live in that space as well if you need immediate reference. Across the top of the recommendations page, you'll see filters. So these are options for you to utilize. You can or you can choose not to, but certainly an easier way for you to find the information that you might be looking for. So under key area of action, it lists each of the different areas of the focus areas for the recommendations within the plan, and you can select one or more of them. Spectrum level identifies the specific spectrum that you might have interest in. And then certainly the implementation level is dependent on where you are and what your focus area is. If you have interest in narrowing down a little bit further, even we've been able to add some filters on the level of evidence as well. So those are all options to you in order to find the information that you're looking for. So I went ahead just for you all to see really quickly. I added in a couple of filters so that you could see how it filters it out. I selected barriers, entrapment, and electrical safety, influencing policy and legislation at the county level. It popped back 9 recommendations, and without cutting into all of it and bringing it to a screen where you couldn't read a thing, I just cut the screen page down to show the one, but there are 9 recommendations that did populate with that particular filter. So whatever your filters are, it will show you how many recommendations it serves back to you. If you click into the recommendation itself, so each of them has a live link associated with it that will take you to a different page. So this is BEE 2. This was the top one on the previous page. And these are all the different supporting documentation areas that the working groups provided when they submitted the recommendations to the steering committee, well, a couple of years ago now, I guess. But you can see that there's a rationale for the recommendation, the anticipated impact, the evidence sources are listed here. So if you wanted to go and look into the resources themselves, the high-risk populations that this particular recommendation would address, the evaluation metrics you might want to consider, implementation, what are the things that you need to think about as you go into implementation of this particular recommendation, what are the challenges to implementing this recommendation, and then who are the potential facilitators? May it be government, your local, sports associations, you name it. Some of those have been entered here into the potential facilitators so that you can give some thought as to who are the additional folks that you might want to bring into your circle as you're going through this process. Some of the recommendations also have additional information under gap recommendation. So for this one in particular, the group felt that there was additional context that was needed based on the work and the research that they had done. And so that information has been provided here as well. These gap recommendations in many cases are also where some of the research agenda is going to pull from. So again, each of the recommendations has this information to different extents, but each of them has this information available. One of the other areas that we've talked about as a steering committee for a long time, and the World Health Organization has done the same recently, is trying to determine where is action actually taking place and how do you report that to us, right? How do we gather that information for what's happening out there across the United States? So this is our first effort at trying to collect some of that information. So if you are in the process of developing a strategy, bringing together a coalition, if there's specific work that you're doing on one of the national implications, or you're doing some research that might feed into the plan, or you've noticed a gap that you're doing research on, then we ask for you to fill out this information. It's a simple form. It will share with us the information that we need to be able to make notes and to be able to document the process as we move forward in this plan. And then lastly, the contact us page. There certainly are going to be things as we go through this process that you have questions on. If you need to reach out and you're looking for specific information, if you want to connect with another group or party in another state that might be doing some work and you don't have their contact information, then this is certainly an area where you can enter that in. It will come directly to us and we can relay that information back to you. I would also suggest as you go through the website, if you do find any things that need updating, if you see error codes or this, that, or the other, please share that with us through this particular form, and we'll make sure that we get that corrected. The last thing that I wanted to share with regards to the website is at the footer. At the bottom of the website, you will see, again, a link to the action recommendations. And then there's also a newsletter sign up. The contact us form is linked here, and then certainly we have a donate form as well. In addition to that, our social media handles are also listed here. So if you're not already following us, if you're not already signed up for the newsletter, this is an easy way for you to do that. All right, that's what I have for the website, and let me see how I can send it back to Megan.
Great job, Tina. We're all very excited about the website. We know we have lots of work to do to continue to refine it and to update pictures and add more information as it becomes available, but we're really pleased with where we are and hoping that you all find it to be a very useful resource. With that, I'm going to pass it over to Tessa Clemens from the CDC, who's going to provide us a look at the World Health Organization's report on drowning that was published about a month ago. Thanks for joining us, Tessa.
Hi, everyone. I will just try to share my screen. Oh, it's not turned on. It's okay. I think
just a second, Tessa. Tina, if you make Tessa the host, then I think she'll be able to share her screen.
Okay, are you seeing the report there? Great. Okay, I'm just going to highlight a few sections. So this is a over 250-page report, so I definitely can't get really into the weeds in the time on this meeting, but just wanted to make everyone aware of this resource if you're not already. This is the first global status report on drowning. So a global status report is a comprehensive document that provides a snapshot of the current state of a particular issue. It often includes data and trends, and it serves as a benchmark to track progress over time. So this report is quite different from other reports on drowning that you might have seen from World Health Organization in the past. So for example, the global report on drowning was really just to galvanize attention around the drowning issue, and most of the subsequent documents have been practical guidance for drowning prevention. But this is the first time that the World Health Organization actually reached out to member states to collect data on drowning in the country, as well as the activities that are going on and the sort of current policy analysis. So, or state of policy, sorry. So this report summarizes available data to help understand drowning burden both globally and at the country level. And it provides an overview of trends since 2000, with the most recent data year that's included being 2021. It also has findings on the global status of drowning prevention governance efforts, so where there are bodies that are sort of overseeing and leading the drowning issue in countries, and it looks at legislation addressing drowning prevention risk factors. It provides an overview of the status of key actions. Most of those are sort of around actions that WHO has recommended for drowning prevention and what the status of uptake of those are in various countries. And it highlights gaps in knowledge to inform future research on drowning prevention. A key aim of the document is to strengthen the network of individuals working on drowning prevention around the world. And this is done both by the document itself as a resource, but as well as through the process of creating it. So each country was asked to have some sort of key drowning prevention groups come together and complete the data collection exercise for the report. In the US, we've already done very similar activities, actually at a much larger scale through things like the US National Water Safety Action Plan. But in many countries, this was the first time that key actors had ever come together to talk about drowning prevention in their country. So the report galvanizes that kind of activity. I'll just mention that the report is structured around 5 key domains, and these domains all help guide the implementation of drowning prevention efforts, and they're associated with key actions in the UN and World Health Assembly resolutions on drowning from 2021 and 2023 respectively. You might remember that that UN resolution also established World Drowning Prevention Day. The resolutions also called for the creation of this global status report, and a number of other actions that are organized in these domains. So they include things like governance and coordination, so looking at whether there's a government focal point for drowning prevention, policy and legislation, sort of broadly looking at things like disaster risk management policy and boating and alcohol regulations, community level interventions, including installation of barriers and other community interventions, awareness raising, and data and research. So there are 9 sections in the report, and the first 1 through 6 sort of summarize what's found in each individual country, but at the global level. So it talks about the global burden of drowning, and then it summarizes the status of the sort of actions in each of these domains at the global level, talking about examples from different countries and gaps and things like that. Section 7 of the report provides an overall summary of the results and the discussions associated with that. So if you're not going to get through all 250 pages, I would recommend Section 7 for that sort of overview. And I'll just give you a couple of the sort of key findings. So the report shows that the rate of deaths from drowning dropped by 38% between the year 2000 and 2021. So we are seeing an encouraging trend overall in drowning rates, but the report does note that drowning remains a major public health issue, with more than 30 people estimated to drown every hour and 300,000 people estimated to have died by drowning in 2021. And there are some limitations to global estimates, which mean that that might actually be an underestimate of the true burden of drowning. Almost half of all drowning deaths globally are among people below the age of 29. And a quarter among children under 5 years of age. So children really at high risk globally. And it's important to note that this progress we've seen in reducing drowning has been uneven. So at the global level, 9 out of 10 drowning deaths take place in low and middle income countries. And the WHO European region saw a 68% drop in the drowning death rate between 2000 and 2021. Yet the rate fell by just 3% in the WHO African region. And this might be influenced by the levels of national commitments to address the issue. So where this report also collected data on whether countries had a national strategy for drowning prevention. And in the African region, only 15% of countries did, whereas 45% of countries did in the European region. So this report really gives that kind of overview of what's happening in all of the countries and how that might be impacting drowning burden. So I'll just quickly highlight the US country page. So at the last section, section 9 of this report has these summary pages for each of the member states, the WHO member states. And so you can see here the US page, which sets out all of those domains that I showed earlier and sort of where the US is in terms of achieving those things. So under governance and coordination, there's not currently a national focal point for drowning prevention at the government in the US. There's not one government agency who has been sort of identified by the government to be the lead of drowning prevention. There is a national drowning prevention strategy, and there is a national coordination mechanism for drowning prevention. So you can kind of see a bit of a report card, for lack of a better term, on drowning prevention that can be used as a benchmark, so that with our collective efforts in future iterations of this report, hopefully we see particularly those orange boxes, which indicate that an intervention is at a subnational level with limited coverage, start turning towards yellow, for example, which would mean that they're at a subnational level with extensive coverage. So super quick overview. I don't want to take more than my allotted time, but just to say that this resource does exist. I will drop the link in the chat so that you can review the report and get a sense of sort of what's going on globally in drowning prevention, and understand sort of areas that we can work towards, and a number of ideas for drowning research, which align well with the efforts to work on a drowning research agenda in the US. So thank you very much for the opportunity to share that.
Thank you very much for that, Tessa. It was very thorough and helpful. Before we let you go, there's a question in the chat around whether there's any data included in the report on autism rates, specifically globally.
So let me just take a second, because I was on the technical advisory group, but I don't have the whole thing memorized before I confirm or deny. I'll take a quick look and answer it in the Q&A. But because we were looking for sort of baseline data that could be reported across all countries, and most countries would not have that level of detail, I doubt that it is in here. I'm quite confident, but I'm going to double check before I say that and answer in the chat.
Thanks, Tessa. And we'll be sure to include a link to the report following this meeting, so that if those of you that are on the call haven't accessed or reviewed the report yet, or downloaded the app, which is a really great feature to kind of get a high-level look at what the report includes, we'll send you all the information you need to both review the report and to download the app.
Thank you for mentioning the app, Megan. I meant to mention that too, and it is a really helpful resource.
Absolutely. Okay, great. Well, thank you, Tessa, for your time today and for that report. It was really interesting. Now we're going to bring in our folks from New Jersey. Tina, could you let Judith and Cait in?
Need to grab it back from Tessa really quick.
But while we're waiting on that, we are fortunate enough to have Gwen McNamara here from the American Red Cross, a representative from New York. Gwen, would you like to take yourself off mute and introduce yourself?
Sure, thank you. Yes, thank you for inviting me. My name is Gwen McNamara. I am with the Red Cross, and I'm the Northeast First Responder Sales Director. And as part of what I get to do is I'm also sitting as the Secretary for the New York State Temporary Commission for the Prevention of Childhood Drowning. So that's my introduction.
So wonderful to have you joining us today. It's been so interesting to see the way states around the United States are activating in this work, right? We saw California release its California strategy even before the US released its national plan. We're seeing our friends in New Jersey about to release their plan. A lot of work underway in Texas, Arizona, Florida, Idaho, Hawaii, and others. And really interesting to look at the way New York has tackled water safety and drowning prevention resources. So while we wait for our friends from New Jersey to join the room here. Could you share with everyone in this meeting a little bit about how the commission was formed and how the commission has evolved, some success stories and things like that?
Absolutely. So in 2021, a temporary commission was put together in order to address 5 very specific areas of concern for drowning prevention in the state of New York. And from that, we've expanded that and been able to influence a lot of things across the state as we work toward being one step closer to having a statewide water safety action plan. And some of the areas that were included in this was to isolate what the recommended ages were for when to start swimming lessons and water safety education. It also set to lay out what incentives look like to encourage participation in programs. It included developing a comprehensive plan between private and public and government entities in order to be able to subsidize programs. It also want to discuss underserved areas, which we then expanded into under-resourced because we really did recognize that there was a real difference between areas that simply don't have access and what those different things mean. And then putting all of that together to making sure that we're communicating these things effectively across the state. From there, we've expanded and included a large number of recommendations for future considerations across the state. But we are absolutely working on some great comprehensive plans with regards to the data, really recognizing that there is a gap in some of the data numbers. So there's an opportunity to really learn more about what the drowning numbers are across the state so that we can make some more data-driven decisions as to what recommendations really come out. Currently, a lot of the data comes from regulated facilities, and there is a real opportunity to learn more about some of the drownings and water-related injuries that occur in areas that are not regulated. And so being able to explore and pull that all together to make sure that we have a full data picture is really one of the components that we're working to do, as well as making sure that if we're working on incentivizing water safety education and water lessons, of not only doing it from the swimming lesson, but also those ancillary things around that. And that includes the access to transportation, to swimming suits and equipment and bathing caps and all of those. And sometimes where appropriate, whether or not food is a need in that area and whether or not that's a barrier for them to be able to learn about swimming safety, and making sure that we're including water safety education as part of this so that we understand that the swimming lessons and swimming education doesn't have to happen only in a pool, but we can really change the numbers based on making sure that we have education in all of the different areas. So it's been a really great process. And in addition, we've also identified so many other areas that for future consideration to explore as part of those opportunities. So, and that includes the development, as was said earlier, about an office that's actually dedicated to water safety education and prevention and drowning prevention, being able to create a data hub of information as well as resources in the state for not only for parents, guardians, and caregivers, but also for professionals, as well as that data. So working to bring all those stakeholders together to make sure that they're sharing obstacles and opportunities and looking for solutions to line up regulations, to line up resources, to line up all of the things to make sure that we're creating this very cohesive vision of drowning and water injury prevention across the state and really shift those numbers to improve in all areas. So we're really looking forward to it. We are planning on a summit type event this fall to kind of kick everything up. And as part of our efforts, we've actually been asked to continue on after we write up all of our recommendations in order to turn some of our recommendations into legislative recommendations. So great things that are coming out. So happy to answer any questions on that one while I cough.
We're all doing it. It's the season. Gwen, how long has the commission been extended through this new action that the governor has enabled?
Currently, it's been extended until December of this year, and that includes the opportunity to take our recommendations into legislative recommendations. But as things go, it's been extended twice already. So, you know, we're kind of open to the idea of it being extended into 2026.
Wonderful. I see a question in the chat here from John Moore, who's wondering how to connect with people in Massachusetts or nearby in New England. So perhaps when you're finished, you're part of the conversation here, you could connect with him in the Q&A.
Absolutely. We've certainly had people even joining our, you know, we meet about every 2 weeks and it's a virtual public meeting. And we have people that have joined us from other states, including Vermont, that are watching what we are doing as well and participating as well. So, you know, happy to add you to our list, anyone to our list, and to come on in and join us.
And how many members are on the commission in New York?
So there are 8 of us in totality of the actual sitting commissioners.
Okay. And then another question that I had, and I wonder if other members of the steering committee, Lindsay, Connie, David, Tina, may also have some questions as well. But a question that I had is, what do you think really motivated the governor to form this commission? I think this is something, this type of commission is really to me, the closest pathway that I can see towards something becoming permanent within the state. So it's really exciting to see this evolve in New York. And so I'm wondering, how can we replicate what has happened in New York? What is it that kind of enabled or kind of pushed the governor to set this up?
So it was a senator that actually spearheaded this and was able to get some other things in place. And usually, as what often happens, there's a personal connection to it. And so there was a child, an area of concern for Senator Pfeffer Amato. I always mispronounce her name. But that was that point too. And it ended up being kind of a precursor, and they kind of ended up overlapping with the governor's New York Swims initiative. And so, you know, there are people on our commission who have interacted with several advisors from Hochul, Governor Hochul, and helped contribute to some of the steering and the thought processes around New York Swims. So, you know, as usual, it's a personal relationship and a personal connection with a water injury or a drowning and so forth that usually spearheads this. And in this case, that is no different. And luckily, right, the right people were speaking to Governor Hochul, who really saw the need and really jumped on board. And their advisors have been very, very collaborative in the experience to make sure that we're all speaking on the same thing. So there are some things where New York Swims and our commission efforts are somewhat overlapping, which is a fabulous thing. It means we're all on the right track. Oops, you're on mute, Megan. There we go.
Any future plans for your commission to recommend the development of a New York water safety strategy, much like what we see published in California or like the work that is happening in New Jersey right now?
Yeah, so we were given a 5 core list of focuses that they were words are hard, right? Were asking us to answer. But in addition, we've added an additional 17 recommendations for future considerations. And one of those is a statewide water safety action plan. That does become much more comprehensive, although ours is pretty large and comprehensive. Our document, as it sits now, is about 200 pages. So we have gone well into lots of different areas of it, and included in our overall recommendation is an office of water safety with a director. And somebody that will be there to spearhead both the conversations and to try and add to some consistency across the state. Because I'm sure, similar to lots of states, different governing entities have different regulations, and sometimes they butt up against each other, and sometimes they overlap, and sometimes they're drastically different. So trying to make sure that some of those are a little bit more consistent, but those are part of our goals and expectations with that. And our plan also includes future recommendations for consideration for backyard pools and jetties and and PFDs. There's so many things because, as we all know, water safety is such a vast discussion. And getting into all of those things and facility usage, it's vast. And if we were to try and cover all of it, we wouldn't be here. But hopefully by developing of this office, there's a future plan to keep that momentum going and evolving and being an ever living thing and not just a very static thing to not address any changes that are happening.
That's great, Gwen. Thank you. Any other questions for Gwen? With that, we'll keep you on as a panelist, Gwen. Thank you so much for sharing your experience and your time today. I'll have my friends from New Jersey, Cait Waxler and Judith Leblein Josephs, introduce themselves, and we'll ask you a few questions about your experience in New Jersey. Judith, why don't we start with you?
Well, Megan, for you, I wore my water safety earrings today, and we all Cait Waxler, but yours are in the mail from what I heard, Megan. So next one you can wear them. My name is Judith Leblein Josephs. I've been rumbling around New Jersey aquatics and amusements and water parks for the last 45 years, and wound up being one of the founding board members of the New Jersey Swim Safety Alliance that formed during COVID. And our chair is in the center square today is Cait Waxler. Cait, you want to say hi?
Sure. Hi, everyone. My name is Cait Waxler. I am with, my day job is with the American Red Cross Training Services. I cover the great state of New Jersey and the Philadelphia metro area. And then in my free time, I am the board chair of NJSSA, which is New Jersey Swim Safety Alliance. As Judith said, I'll give a little bit of background on NJSSA, and then I'll turn it over to Judith to speak a little bit more about the plan. But NJSSA's 503C started during COVID when we realized that pools were not opening as quickly as a lot of swim professionals would like. Pet shops, tattoo parlors were opening, and indoor swimming pools were not open yet. So NJSSA formed to say, hey, how can we swim safely during COVID? We know it's a chlorinated environment, and we saw drowning rates start to go up because there wasn't access to swim lessons because we didn't have indoor pools. So a board got together and we thought once, COVID was quote unquote over, we would be done. But we've realized that a lot of us who were kind of seen as competitors, swim school owners who were kind of in the same space, YMCA leaders, park and rec leaders, water park world, that we worked really well together and that our work wasn't done because the drowning rates were still going up in New Jersey. So we decided to keep going as an organization, to officially join together as a nonprofit and to really tackle drowning prevention in the state. So that's kind of where we are now. We had two great events that Judith will talk about, and we're really tackling having a New Jersey strategy, state specific to New Jersey. And I will turn it over to Judith to talk about the specifics of the strategy. And we're really lucky that we were kind of voted from a ton of different stakeholders to be the voice of aquatics and to be the voice of this strategy, which is really great. And we did work really hard to have diverse voices for the strategy. So, you're expecting your pool operators, you're expecting your YMCAs, your park and rec, but we really went beyond that to talk to our state police. We even have a professional mermaid, I didn't even know that was a thing, join us to really make sure that we were looking at all layers of drowning prevention, and we had as many stakeholders in the room. And so, Judith, I will turn it over to you.
Well, thanks so much, Cait, and thank you for having us. And Tina, congratulations on the Water Safety Plan website. There's good news and bad news about the National Water Safety Plan. The good news is it's so extensive. The bad news is that it's so extensive. There's just so much to do. So congratulations to be able to encapsulate that in a website. I have the paper document filled with sticky notes because I will be one of the two authors of the Ultimate New Jersey Water Safety Strategy. I have the honor of working with somebody I admire a great deal, and that is Chuck Warner, a USA Swimming Hall of Fame coach, last at Rutgers University, University of Texas. but owns Little Dolphin Swim School. And so his heart is in learning to swim. So Chuck and I will be writing the strategy. And the strategy is a result of the 2 Garden State Water Safety Summits. The first, we were pleased to have Megan attend. The second 2.0, unfortunately, she was under the weather, but we were so thrilled with who came and the participation and the desire to have the already formed coalition, the Water Safety Alliance, be the voice of water safety in New Jersey and for New Jersey. That was confirmed at Garden State Water Safety Summit 2.0. And we are incredibly proud of the collaborations that have already happened by getting all these bodies that care about water safety in the same room. Gwen, we are a little jealous of the state of New York and what the governor has just announced. But at the same time, I know your delegates came to our 2 summits and are a little jealous of our process. So I think that keeps fueling us forward. We probably made the leap into doing the statewide strategy because of the Zach Foundation. So had they not given us that little nuzzle, we probably would still be lingering and not have that direction. So thank you, Megan, and all the help you provided from the Zach Foundation.
So Judith, thank you so much. I'm wondering if you can tell us how you got to having your summit, you know, a year, not even a year and a half ago, 13 months ago, to being so close to having a strategy that's ready to be published. Can you talk with us about those working groups that contributed to that plan?
I'd love to share that. And that's why my comment to Tina was because it's so vast. But what we wound up doing is in the first year, we went to breakout groups and people were assigned to different breakout groups to talk about, at that point, we had 8 major roadmaps. We used the water safety plan and used the word roadmap. So we had 8 roadmaps in 2024. And each one of those roadmaps, after these beautiful breakout sessions, there were no fights. Everybody got along, but it was robust. And we wound up with each one of those 8 areas having maybe 15, even sometimes 20 things to do. And what we did then is we consolidated all that and we went in the second year of 2.0 and made 6 lanes. And those lanes were data consolidation, driving public awareness, drowning prevention, lifeguard training and development, sustaining and financing the mission, and collaboration. And within those 6, now in Garden State Water Safety 2.0, we said, okay, last year you gave us 15 in each of these categories. You got to pick 3. And you have to make those action items that we can identify and we can focus on. So they're down to 3 in each one of those lanes. And we put the others in the parking lot. Doesn't mean they're not important. We hope to get to them, but there's only so much you can do. And so, and so much you can put in a document. And Gwen, there's no way I'm going to let this document be 2,000 pages. It just, you know, I'm too tired to do 2,000 pages. But so it was a beautiful process. You know, we knew in theory it would work, but when you say, Cait, it was just a beautiful evolution of people talking and such great ideas that we're really excited. Now we're going to vet this one more time at the New Jersey Recreation and Park Association conference. And not just that the rec and parks people are the only people, I mean, including our friends, the professional mermaids, but the Marine Police, the Coast Guard. It was an amazing array. Beach lifeguards, and beach life is so important here in New Jersey, and our waterfront people and lakes and streams. And one of the biggest problems, and I'm shocked at what Tessa has been able to do, is statistics. You know, everybody that we talk to that has tried to put this kind of work forward is always hungry for statistics and the right statistics and timely statistics. And I think everybody, I see Gwen kind of nodding a little bit, that's been the toughest thing is the stats. So Megan, we started in 1.0 and we got into big working groups. Then we got the working groups a little smaller. Now one more vetting. Everybody's been able to look at it who's interested, and we're bringing it forward. How to take the leap. And we had a meeting just before this of our alliance, of our Swim Safety Alliance. How to take the leap from being influential and being chosen as the one voice. I mean, in New Jersey, that's amazing for everybody in their silo to go, okay, you guys do it. And we're representative of all those people. And getting there is so much, but getting to the point where the governor declares it a priority, that is what we have to figure out. And we're hoping that releasing the strategy as a part of May is Water Safety Month at perhaps one of our major indoor water parks and doing some buzz and getting some buzz going. But I do agree. We talked about it. It was almost like you were listening in, Gwen, in our meeting today, is until it hits home, until, for example, right now we have a beautiful playground law that's providing funding for totally inclusive playgrounds called Jake's Law, named after a little boy that died. And maybe we need to find that kind of sponsor, you know, to get that attention. But we're working with several of our assembly people and state senators to try to get us over the goal line on this, to get us to a point where the state sees it as a priority once again. When I was in college, the priority was you couldn't graduate from a New Jersey State college without knowing how to swim. So I taught athletes how to swim. That's how I made my college money. But then it disappeared. City pools closed, funding disappeared, focus disappeared, and drownings went up. So does that answer your question, Megan?
It does. It does. And we only have a few more minutes here before our webinar comes to an end. But before I let you go, Judith, I was wondering, I'm always thinking about practical and tactical solutions. And one of those that I think is so exciting and useful and replicable and scalable is your bathing suit drive. So
Thank you so much. How did I not talk about that?
I don't know. Could you give us 2 minutes on your bathing suit?
Yes, and
Okay.
everybody should do it. And what
Yes.
I have to say is the World Water Park Association heard about everything that the water parks in New Jersey were doing, and they embraced the alliance. And there will be a feature article in the World Water Park magazine about the New Jersey Swim Safety Alliance and the summits and the bathing suit drive. So we joined NJRPA, the New Jersey Swim Safety Alliance, and Dolphin Swimwear. Last year, we collected statewide 3,300 bathing suits and distributed them to agencies that offer free or reduced fee swim lessons. And we have been told by those agencies that received those bathing suits that we saved the day. They were offering free classes and kids would show up with no appropriate bathing attire. And everybody got involved. Just a couple days ago, my husband and I picked up 1,600 boys' bathing suits from a vendor in Little Ocean Township, New Jersey, who loves what we're doing, so much so that the owner of the company at 75 years old is taking swimming lessons. So there have been so many direct deliveries, not only of bathing suits, but our cards with our instructions about safe swimming that have gone statewide. We have more children having access, and we now are working with Rowan University on a grant to prove that our slogan, bathing suits lead to swim lessons save lives, and whether or not that is true or not statistically. But I would be happy to coach any state into how to do this bathing suit drive statewide. And you can tell I'm passionate about it. My basement is no longer accessible to me. It is filled with bathing suits waiting to go out in April, out to the different organizations. And it's not just people in public, in swim lessons. It's also surfers teaching autistic children how to surf. We help them with life jackets and bathing suits and goggles and swim caps and 7,500 swim diapers from our friends at Walmart. So once you tell the story that there's a child in New Jersey who can't access free swim lessons because they don't have a bathing suit, it explodes and bathing suits arrive. So I would love for everyone else to do it, and I'd love to help anybody do it. And I have to thank New Jersey Recreation and Park Association for saying, come on in, let's do this together. And they started it. And then Dolphin Swimwear put us over, man, they just started. We are starting this year, 2025, with over 3,000 bathing suits. Amazing.
Really
one
wonderful.
bathing suit at a time, one kid at a time.
Congratulations on that.
Thanks
Judith.
for asking about that. How could I have forgotten that, Cait Waxler? That's all I talk about.
Well,
And I really want to say for any states, this really started small, grassroots. So it wasn't anything major. We're now scaling it, but It really started small, grassroots, one water park donating to a homeless shelter, and it really grew from there to the point where, you know, large municipal pools have bathing suits on stock. So if a kid walks in on a super hot day and can't get in the pool, hey, walk away with a brand new bathing suit, and then a water safety card with information for their parents and caregivers. So it started small. I know it seems big, but it can really start small and grow from there.
One bathing suit at a time. The first drive was about 100 bathing suits. We have even had New Jersey water parks offering a free kids pass in exchange for a free kids bathing suit. That's astounding.
That's amazing. Thank you so much for sharing that, Judith and Cait. You know, as I reflect back on the last few years of this work and thinking about this webinar last year, we had experts in leadership from California and Texas last year. And this year we have experts in leadership from sorry about that. Last year we had experts from Texas and California, and this year we have experts from New Jersey and New York, and really excited to see who joins this webinar next year. I think I saw we had about 110 participants in this meeting today, and so I hope we were able to provide you with a very clear update on where the plan is, on where we intend to go. These working groups that are underway right now, I think will have some really interesting progress to report out on at the 6 and 12-month marks. And so really excited to continue sharing with you, encouraging you to join our monthly office hours. We have them focused at both the state and local levels. And so it's a really important resource that we provide, with steering committee members providing feedback and recommendations and support, but also, and much more importantly, having that peer-to-peer support. We have experts in leadership at both the state and local levels join these webinars so that from a peer-to-peer perspective, we can share best practices and ensure that we're replicating successful strategies. So as we close out this meeting here today, I want to thank all of you. Many of you have been involved in the success of the plan, the development of the plan, and now in the implementation of the plan. And so looking forward to hearing some feedback from you, to continuing to collaborate with you, and to ensuring that we move the United States forward in a positive and progressive way. So thank you for your time today, and look forward to our next meeting.